My name is Jordan Campbell, and I am a radiation oncologist. And as a doctor that specializes in radiation treatments, I am here to discuss how radiation can help and benefit the deadly disease of cancer through therapy. Now, what is radiation? Radiation is simply the penetrating rays and particles that are emitted by a radioactive source. The key word is emit, which means to discharge or to produce. Radiation therapy can be used in low or high energy. High energy radiation, or ionizing radiation, includes therapies such as simply the sun or an X-ray. Then there is low energy radiation, or otherwise known as non-ionizing radiation, which consists of radio waves and heat, which is obviously being less powerful than the sun, which is a part of high energy radiation. With having enough energy to break through chemical bonds, the energy knocks electrons out of their atoms, therefore damaging the cells and hopefully killing the cancer. The therapy doesn't always kill the cancer cells, though, as in some cases it simply relieves some of the side effects of this horrible disease. It's simply important that doctors, such as myself, are careful when giving radiation as to not damage or kill the non-cancerous cells. With this concept, doctors all around the world have been using this technique on many patients as a primary source or a secondary source to kill or cure the cancer anywhere in the body. This therapy can be used as additional help to past or current surgeries, or you can simply use the therapy itself. This usually depends on the degree of the cancer, or the type of cancer you're dealing with, and the seriousness of the cancer. There are three main types of radiation therapy, and the most common one that is used is named external beam therapy. In external beam therapy, it involves giving radiation from a machine that is located outside of your body. The machine creates a radiation beam that is called a linear accelerator, otherwise known as a LINAC. The LINAC uses electricity to form a stream of fast-moving subatomic particles, which then creates high-energy radiation that is used to treat the cancer. There are some more specific types of external beam therapy, and here are some examples. There's 3D conformal radiation therapy, there's intensity modulated radiation therapy, image-guided radiation therapy, stereotactic radiosurgery, proton therapy, tomography. These are all specific examples, and it's very important to be specific on which one you use to target a specific type of cancer, because it all depends on what the type of cancer is. Now, the second type of radiation is the opposite of external, as it delivers radiation from a radiation source that is placed inside or on your body. This is known as internal radiation therapy. Now, most of the radiation comes from the source itself, but a fraction of it is actually emitted from the body. Now, in the source, radioactive isotopes are sealed in some sort of concealment as to be injected or placed on the body. The isotopes then decay naturally, giving off radiation. This type of radiation is used specifically to target a cancer as to decrease the risk of damaging the healthy tissue, and it is commonly used to decrease and target tumors. The simplest type of radiation therapy is known as systemic radiation therapy. This is where radioactive materials such as strontium-89 or iodine-131 are bound to a monoclonal antibody and are taken by mouth or injected by a catheter or a needle. A monoclonal antibody is a type of protein that is made in a lab specifically to be bound to one substance, and in our case, it is cancer cells. These come in handy when the radioactive substance is already naturally bound to the target, such as how iodine-131 is already naturally bound to thyroids. So when we are dealing with thyroid cancer, we just inject iodine-131 and it already goes to the cancer cells in the thyroid. Chemotherapy is one example of systemic radiation therapy, as it's popularly used to do things such as to keep the cancer from spreading, slow its growth, kill the infected cells, or even cure the cancer. Now, with these therapies, there will always be some slight side effects. In this therapy, we are dealing with radiation, so of course there will be some slight skin problems, such as drying of the skin. There can be itching of the skin, blistering of the skin, or even peeling of the skin. And patients can also suffer from slight minor fatigue, but that's not our biggest concern. The side effects overall are more specific depending on the type of cancer that is being dealt with at the time. But overall, these three types of therapy benefit cancer as a whole. When successful, the cancer cells are destroyed without harming any healthy tissue. This therapy can team up with another treatment to attack the cancer even more, making a better outcome. It can treat tumors and reduce pressure, pain, and other symptoms of the cancer. With the study of nuclear chemistry, radiation has revolutionized into a phenomenal therapy. It has become one of the many treatments to fight against the monster as we knew today, cancer.